Welcome to the RevMD podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Verde Golembieski, family nurse practitioner here at RevitalizeMD.
Today, we are going to talk about how to improve your erections, how to improve erectile dysfunction with a procedure that we've talked about in the past. And so, what is the PShot? That's what we're going to talk about today.
Yeah, so the PShot is platelet-rich plasma. So it is your own blood product. And when you come in for these appointments, we draw your blood, we spin it down, we take that platelet-rich plasma, which is full of collagen and elastin, and it helps with helping to that vascular
All the growth factors.
Thank you. I'm like,
Yeah.
I went blank.
I
We've
was
done
like,
a lot of these podcasts today. Sorry, guys.
yeah, it was the growth factors, like all the growth factors, all the
growth
special
factors.
things. Yeah. It is the magic of your blood and your blood products to stimulate growth of everything, and so including erections. But basically, platelets, again, when we draw blood, and it depends, there, I think one of the problems, and that's what we're going to talk about today, like what is the PShot? What are some issues that we have in studying that? Do we need standardization, and what are the results that we're seeing in studies and clinically? So the PShot, like Verde said, is the platelet-rich plasma, and we draw blood, spin it down, get all those platelets, all the good growth factors, and re-inject them into tissues to stimulate regrowth of vessels and nerves, and so better blood flow into the penis is better erections, stronger erections, better sensitivity, better orgasms, better ability to have orgasms, because that's a big erectile dysfunction finding that people don't frequently report is, yes, you want to consistently get erections, you want them to consistently last, but also some men have decreased sensitivity and decreased ability to have an orgasm. And so sex goes on for a long time with a dissatisfaction of both partners because of that inability to have an orgasm. So it also improves sensitivity. So we use your blood and all the magic in your blood to stimulate all the good things to happen in the penis again and
Yep, for
regenerate.
that vascular regeneration.
Yeah. And so basically, this is something we've been doing for, again, I've been doing the entire, practice. We do combine it. So we've been doing it for 7 years now. We do combine it with other treatments. And when we're doing erectile dysfunction, we always combine it with an acoustic shock wave, which is acoustic or sound waves that are communicating with the tissue to regenerate as well, and then combine that with the PRP injections. Right?
And oftentimes usually most of our patients are also on a form of hormone replacement, or they're doing other treatments, peptides, or potentially medications with the goal to come off medications with this treatment.
Yeah.
So it is very comprehensive. It's a multifactorial approach when we're talking about erectile function. So it's not just the PShot, but what's interesting is the studies today do talk about just the PShot and improvements with just the PShot. So when we're talking about the studies and we're talking about the benefits guys are receiving relating to the PShot itself, just think that's only one aspect of what we're treating. So when we add all these other modalities in, when we're doing shockwave or Gainswave therapy or shockwave therapy, and we're also helping optimize hormones, it is just makes an even bigger difference in some of these numbers we're going to throw out today.
And I always look at there's two ways of looking at the results. It's one with studies, and whenever you're doing regenerative procedures and it's not a specific, sponsoring from a big company or a drug company, then your studies are never going to be as big or as robust. But even those studies, when funded, have outcomes that might be also tweaked a little bit based on who's funding them. So that's something that I always keep in mind. And so if we're looking for big studies, and that's like the gold standard is pharmaceutically funded studies. I don't think that really works, and that wasn't the way it was. When studies came out, they had to be not affiliated so that we weren't biased. So what we're looking at is results that patients report, and then results from the studies that do exist. And so patients love, getting regenerative procedures. Acoustic shock wave is largely studied with positive effects and positive studies with no adverse outcomes that are reported. Well, the same thing with the PShot or the PRP injections is the studies are a little smaller but positive outcomes and no adverse effects reported. So the safety is there, number one. But now we have studies that support it. So one of them was a 2021, and it was in the Journal of Sexual Medicine. It was a smaller one, 60 patients, two PShots 1 month apart, with again almost 70%, 69% reporting improvement, and then 27% in the placebo group. So a big difference.
That's pretty
And
big. I mean, just think about that. 69, 70% had improvement.
and then 27% if they had a placebo.
Yeah.
And
I mean,
two
that's
shots.
crazy. That's crazy.
And 2 shots, and the end goal was to say at 6 months is there improvement, but actually at 1, 3, and 6 months there was improvement, and the PRP injection group was much happier with the results, and it was about a 2.99 or a 3 point improvement in the scale. And so a SHIM score is what we report. That's also the International Index of Erectile Function, either one of those, but it's a 3 point increase in that. And no adverse effects. So safety was there. But then more recently, they did like a meta-analysis. So they
Which
looked
is
at
awesome because we're talking about something that's regenerative, that has no big pharma behind it. There's no pharmacology, there's no medicine, there's no prescription. This is your own blood product. So very safe.
yeah,
So it's really cool on the medical side to see non-pharma studies.
yes. And so that was studies that they actually looked at all the studies that were randomized controlled, and they took 3 that ended up being randomized controlled and looked at those 230 patients with a significant improvement with the PRP injection group versus placebo, and clinically improved. Happier patients, 230 of them, and no adverse effects. And so those were 2 patients, and that's looking at the studies that were randomized controlled. Now, having said that, and we do a lot of sexual medicine for men and a lot of men's health, I would probably have trouble getting men to agree to having their penis injected and not being guaranteed that they're getting anything more than a placebo injected
Yeah, that's surprising when you think about that. Not many men would sign up for a maybe.
for a maybe. So it's already, if we bring up what we do and we're in a social encounter that, one of the common go-tos is nobody's giving me a shot in my dick. That's like exactly straight up what they say.
Yeah.
And it's a very common comment after they hear what we do. So I can't imagine. So if we're looking at or waiting for large randomized controlled, and a randomized controlled means you're going to inject both with the same procedure, but one's going to get something and one's not. How many are going to inject? I would have trouble getting men to agree to being injected with normal saline or whatever they were injecting, but placebo and not actual PRP. So, and then, it comes to question, like, again, you almost have to have blood product. So I guess they're just injecting them maybe with even just unspun and unprocessed PRP, because otherwise you would know, or you're blinding them. So
Well, you
it
gotta
becomes
think about
complex.
it. It's gold. So, I mean, they probably still draw the blood
Yeah.
and go through the whole process, but toss it and just pull a colored,
Yeah.
I don't know what you would put in saline to inject, but
Or injecting, but not PRP. So they're interesting. So I don't think that we're ever going to have large scale with that. So I think safety is key. So having studies that document safety, results are pretty obvious and stand for themselves just based on the results of patients. And a lot of this is survey related, because we wouldn't have repeat patients or patients continuing to come if there weren't such reviews and, communities that talk about the results. Then we know it's safe. And so I think it comes down to standardizing the protocols more than anything.
Yep.
And so that you know that you have PRP kits that are working, PRP kits that are effective at getting you a good platelet concentration.
That you're spinning at the appropriate rates, that you're doing things in a way that you can track and document what's working and what's not.
Yeah, and so standardizing that, and that's where physician groups come into play. And so guidelines, not many of urologists are doing this. It's more of a regenerative medicine procedure. It's a very safe procedure, as you know. It's a very comfortable procedure, and it works. So based on just patient results in a practice of 7 years in doing this, the results stand for themselves. You definitely want to standardize, and that's where physician groups come into play, like Cellular Medicine Association is the physician group that standardizes the PRP injections for sexual wellness, so O-Shot or P-Shot, because we can do the same thing for women. And so CMA or Cellular Medicine Association, or if you just look like for P-Shot directory, then it has providers that actually have invested the time and money to be trained and standardized on those processes. So that's the one thing that I would recommend is just finding an office that specializes in sexual medicine, sexual
And
wellness.
the P-Shot. If they're listing the P-Shot with the trademark behind it, the trademark sign, they should be trained, certified through that physician group.
Yeah, and you can actually look at the PShot official directory, and they will be listed there
Yeah.
in an area or an area code, and it'll tell you exactly the different things that they're trained on. So that would be my one recommendation. But we get frequently asked questions, and we hadn't done a PShot podcast in a long time. So we just wanted to talk again about what the PShot was. Just know that it's very comfortable, because that is one concern, and I think that a lot of men don't really believe it until they've actually had the procedure. And then what we recommend for a treatment plan for men varies based on what the needs are and what the severity of erectile changes are.
And your shim score and those protocols that are all backed by a large group all doing the same things.
Correct.
So we know what works and what doesn't work. I think it's really important not only to note that it is painless, that it's a very comfortable procedure, but there's also very, very, very minimal adverse effects. So other than potential bruising at the site, this is a very well tolerated procedure.
Yes. And so, again, let us know if anybody has questions, comments, whether you can give feedback into whether you've had it, what your results were, anything else you want to talk about, because we're willing to deep dive into anything sexual wellness or wellness. Thanks for listening.